Away from the jumbos, African countries have been challenged to increase financial allocation in the fight against HIV/AIDS prevalence among children and adolescents. Stakeholders in the health sector, led by Africa REACH, a coalition of health actors, say children have long been overlooked in the battle against the epidemic. According to the health advisor to the President and Cabinet of Zimbabwe, Dr. Agnes Mahomva, lack of adequate funding has served as a major obstacle in the diagnostic and treatment options for children, which exacerbate the prevalence of HIV/AIDS in the continent. The stakeholders, who met in a forum in Nairobi to discuss the steps in advancing adolescents' sexual and reproductive health, further called on African states to work collaboratively to reverse the current trend of transmission of the virus among children.
The UNAIDS report of 2024 that came out in July really highlights once again the gap between children and adults in terms of treatment and results and progress in the HIV response. Much of the success is within the adult population, and children are really being left behind. And that is why we are really focusing and harnessing our efforts in terms of our advocacy messaging on ending AIDS in children, which first and foremost is the prevention from mother to child.
Kenya's got the fourth highest HIV burden on the continent. Homa Bay has the highest prevalence rate in Kenya. We know how to control the epidemic, including in Homa Bay, including children.
We need our governments in Africa to prioritize policies that strengthen the achievements that we're doing, push forward, and ensure that we are not leaving children behind, adolescents behind.